Hello, my name is Brad Kim, and this is my presentation about squamous cell carcinoma of the pancreas. I am in the 8th grade attending the Buckley School, and this is my presentation presented at the ACES conference in Palm Springs, California on October 7th, 2022. The title of my presentation is The Generation of a Novel Mouse Model for Fighting Against Squamous Cell Carcinoma, SCC, of the Pancreas. Pancreatic cancer has the worst 5-year survival rate among all human cancers. The majority of pancreatic cancer is adenocarcinoma, PDAC, and which has been the focus of pancreatic cancer study. However, although rare, squamous cell carcinoma, SCC, of the pancreas is the most dangerous pancreatic cancer, but has been relatively unexplored. Due to this reason, we have created a novel mouse model to explore the pathogenesis and treatment for pancreatic SCC. Based on previous studies, we had hypothesized that the overexpression of p63, the transcription factor essential for epithelial stem cell self-renewal, would lead to pancreatic SCC. However, we revealed that the overexpression of p63 alone was not sufficient enough to drive the development of pancreatic SCC, and that both overexpression of p63 and the KRAS mutation, the primary cause of PDAC, was necessary for the initiation of pancreatic SCC. Through continued research of this mouse model, we aim at finding the effective therapeutic treatment of pancreatic SCC. Most epithelial stem cells express p63. Stem cells are capable of self-renewal, meaning regeneration. With this, they can lead to Ta cells, and that can lead to terminally differentiated cells, which are functional and mature for the body. Here we can see the anatomy of the pancreas. Right here is the spleen, intestine, and the bladder, and this yellowish body of mass is the pancreas. The typical pancreatic cancer looks like this. Unfortunately, we discover pancreatic tumors when they get extremely large and late. On the bottom right corner, there's a measurement of 2 centimeters. So the pancreatic tumor can get quite large. The most common form of pancreatic cancer is ductal adenocarcinoma, which comprises of 85% of all pancreatic cancers. Squamous carcinoma, 0.5 to 5%, are fewer in percentage, but are even more aggressive than adenocarcinoma. And as we can see from the table, squamous cell carcinoma patients can expect to live less than PDAC patients, with 4 months without surgery and 12 months after resection with squamous cell carcinoma. On the other side, PDAC, without surgery, you can expect to live up to 5 months and 16 months after resection. The slide on the left is a picture of the normal pancreas, and it lacks in p63. However, when the pancreas is starting to cause problems and squamous cell carcinoma appears, it overexpresses p63. This is a controlled experiment, which would mean a wild type of mice, and this is the p63 transgenic mice with the KRAS gene, and so there are different hues of colors. We can see that on the right that the transgenic mouse pancreas is less pink due to less blood vessels appearing. This is a picture of pancreatic SCC developed in the transgenic mouse. We can see that the pancreatic SCC is mostly comprised of squamous cells right here, which are these pink blobs of mass. The overexpression of p63 alone doesn't do much, similar to wild type of mouse or the control experiment. With the KRAS mutation right here, it caused rapid death in the mice compared to the control. And the red line right here has the overexpression of p63 and the expression of the KRAS mutation, which lives even less than both the KRAS and the p63 lines. Now, PAC4 kinase is a protein and enzyme in our body. It phosphorylates target protein. We discovered that PAC4 phosphorylates and stabilizes P63. With the suppression of PAC4 kinase activity, that ultimately reduces P63 levels, which could mean a possible treatment for pancreatic SCC. We can see here as increase of dosages that the P63 levels go down and the pancreatic SCC growth go down with the PAC4 inhibition. In conclusion, we came up with this is that P63 has a dual function. The positive effect of P63 is that it can lead to self-renewal and regeneration, which is good for the cell. However, the negative effect is that it can possibly lead to cancer with the KRAS mutation. So that is our conclusion of our presentation. Thank you for listening, and we hope that we can cure the patients with the most dangerous type of cancer. Thank you.